Did you know that St. Luke's University Health Network, based in the Lehigh Valley, Pennsylvania, has been recognized by the U.S. government as the highest performing health system in the United States for quality? You heard right. St. Luke's #1 recognition affirms our status as the top leader among the most respected healthcare providers in the nation, including Houston Methodist and the Mayo Clinic. To state it simply, if you want to receive the best care when you go to a hospital, come to St. Luke's.
Listen, all you New Yorkers. Excuse me. Taxi.
Okay, man, we're looking around.
This is the 77 WABC minicast.
Dr. Oz, who's doing an incredible job working alongside Bobby Kennedy, President Trump, the fraud issue that continues to plague America. I have a friend who works for J.D. Vance, and she helped set up this big rally in Bangor, Maine, 2 nights ago. And he talked to the fine folks of Maine about fraud. And Anthony D'Esposito was on the show all the time. Labor Department, he's uncovered fraud. And Lee Zeldin, EPA, he's uncovered a lot of fraud. So it's become a very, very big issue here in the country. So, Dr. Oz, first of all, you look very handsome as always. Good to see you. But let's start right there because, if I'm correct, I just mentioned J.D. in Bangor, Maine. You're about to do a press conference with J.D. Vance coming up on Wednesday, right?
Well, we just had a big announcement with the vice president. He leads the White House anti-fraud task force. So we're doing constant events, trying to make it clear to the American people, but more importantly to the fraudsters that we're after them. So we don't want them walking away. We want them running away from us. And that's because we have all arms of government working together, which historically has not happened with fraud. In the prior administration, quite transparently, there wasn't a lot of interest in fraud. They just didn't think that was a big deal. They weren't focused on it. But when you don't focus on something bad like fraud, the gangsters, and there are gangsters literally involved in this, organized criminal syndicates, they take advantage of the system. So we announced this week that we're going to defer payment of $1.3 billion to California, and that we are continuing to worry about hospice and home health care. So we're going to put a nationwide moratorium on all new programs. If you're already on these programs, you're fine. But no new programs until we figure out how it got so bad and what the problems are. And let's just give one concrete example. Here in New York State, where we're sitting right now, the #1 job in the whole state said, #1 job, personal care service. That means that we're paying kids to carry the groceries upstairs for their parents. We're paying the neighbor's kid to drive you to the doctor's office. Now, there's some times when that's a good investment because it keeps you out of a nursing home. But when you have very weak guardrails, bad people take advantage of the system. And that's why we had to ding California and defer that money to $1.3 billion. And that's why we have to audit a lot of states. And it's not just a blue state problem. Red states have issues as well. We've written letters we actually wrote a letter to Maine, where the vice president was, because they have a lot of fraud up there.
Ohio, too.
Ohio has fraud. Florida, there's twice as many durable medical equipment suppliers in South Florida than McDonald's.
Yeah, there's got to be, because there are so many retirees and old people being taken care of down in Florida. It's going to have to happen, I understand. I think I saw something this week, Dr. Oz, in Los Angeles, where they had these big buildings that they claimed were being used for hospice, and there was nobody in them. Nobody.
So hospice, beautiful program created 40 years ago to take care of folks who have cancer that's terminal. They're going to pass. They want dignity. So you give up your Medicare, you get hospice. Great. 1/3 of all hospices in the entire nation in Los Angeles, not California, just in L.A. Now, if sitting here in New York, I think, well, how's it possible they have 1/3 of all the hospices in the whole country? That's not true in New York, so something's wrong. And in fact, the governor of California, Newsom, was warned by their auditors years ago that they had a growing fraud problem with hospice, did nothing about it. Russian organized criminal elements are involved in this. Many of these cluster in buildings that are empty. Nothing happens. No patients are seen. Or if they are seen, they're not taken care of. Doctors sell their souls, their licenses, to lie that people are terminal, to pretend that they're eligible for these benefits. And they steal billions of dollars from the federal taxpayer. Remember, what we're really saying is if California tolerates fraud that comes from the federal government, that means people in New Mexico, Mississippi, and New York are paying extra tax dollars to make up for the fact that California doesn't care.
Can you explain to my audience, because a lot of my audience are just regular guys. They used to like to listen to sports talk radio. They came to, because that's where I was, and they came to listen to me now because I'm a regular guy. Why? It's true. Why are these politicians doing that? Why does Gavin Newsom allow that in Los Angeles, in California? Why do we just see Tim Walz in Minnesota? Why are these? Are they on the take? Are they nervous? Have to deal with some pretty bad guys? Why are politicians allowing this in all of our states across our country?
Well, there are a couple of factors. There's no question that in Minnesota, there could have been political considerations. You're going to lose a big vote from the city. A lot of Somalians, very politically active, would have been upset with him if he'd taken out their main source of income in some of the communities,
right.
Fraud, leering centers. In California, I don't know what happened, but at the end of last year, as an example, there was an opportunity for them to shut down hospice fraud, and the governor at the last second, it had gone through the whole process. The health department wrote the rule. Governor pulled it down. Don't know why. But let me give you a hypothesis. I don't think fraud is a flaw for some governors. I think it's a feature. And let's just pick on New York. The number one job in the whole state is personal care services, right?
Yes.
Which means instead of letting these people go unemployed and having to pay unemployment insurance coverage for them, you can just get them on the federal dole, have the federal government pay for their salary for carrying groceries, and that you can tax that income. But also now we're learning that the unions are actually getting engaged and they're unionizing these personal care services folks, which means you have now a very politically active organization funneling money through union dues to one party. So it's political patronage. And I think at its very core, that's why some governors aren't serious about this. Other governors just haven't focused on it. They're running sloppy administrations. Some are not as good as others in dealing with these issues. But listen, when we write letters, and I did, to 50 states last week saying, within 10 days, tell me, are you willing to check to make sure all the providers are valid, that they're legitimately allowed to provide these services? Every state wrote back and said they would do it. Mm-hmm. Because the reality is, and I think people realize, this is not a Democratic or Republican issue. Both parties want to fix this problem because it's embarrassing if you're a Democrat that you want to have all this largesse, give all this money in the social programs, and it's getting stolen. Republicans are angry about this process because they expected it to happen. So now it turns out that their fears were validated. We got to deal with it.
And major issue here in New York, which I know you're heading, is Medicare, Medicaid, a lot of fraud coming from those programs.
What we think is $100 billion of fraud in the health insurance industry in Medicare and Medicaid. Let me put it in context for you, Sid. If you're working your tail off right now and you're expecting that Medicare will be there for you when you retire because you've spent your whole life paying into it, that 2.9% on your pay stub, that's what it's for Medicare. So we will double the life expectancy of Medicare's trust fund if we take the fraud out of the system. Double it. Wow. It'll be there for you. Wow. You'll be able to retire and have the social safety net intact for you.
I'm also reading about something you're doing which is really important, and New Yorkers know this story very well, Dr. Oz. You're announcing a new healthcare coalition on prior authorization. So we got a guy in a jail here in New York who's a hero. He's a hero. He's beloved. His name is Luigi Mangione. And what did he do? He committed murder in the most cowardly fashion. He shot a man in the back, a man who was a father of two, a man who worked in the healthcare industry, who, by all accounts, was a very, very nice man. But Luigi was having issues paying his medical bills. He hated healthcare, and he decided that he was going to murder somebody to make sure that justice was done. And again, I'm not kidding you. He's a hero to a lot of New Yorkers. Tell me about prior authorization, what that means moving forward, because the Brian Thompson story relates just to this.
Just to finish the story of the psychotic man, Luigi Mangione, the hoodie he was wearing sold out.
Is that right?
Yes. People like the idea that you could murder someone because they don't like the system. And the man he murdered, he didn't even have insurance with him. It's a different company. So let's leave that tale behind because it's sort of an unfortunate tale, but it does highlight the anger that many Americans feel about the fact they're having this discussion with their doctor in the office, sacred spot. The doctor says, you need this test to figure out if you have cancer. And the insurance company reaches their hand in and says, hold on, Tiger, even though you paid your premiums, we're not sure you're eligible for this test. We'll get back to you in a couple weeks. Well, you're sitting around trying to understand if I have cancer or not that whole time. You're in pain, you don't like it, and you actually paid your bills. So we have asked every insurance company, this is all about the president. President said, you know what? Yeah, you can make laws. Yes, you can make rules, but use the power to convene. Just use the force of personality. Go in there and negotiate. So we went to all the insurance companies and said, the president doesn't like this prior auth stuff. Can you fix it yourselves without us having to get involved? If you do, we'll give you safe harbor. We'll protect you so you can actually get the job done. All the insurance companies came to the table. We've covered now the vast majority of Americans with insurance companies wanting to dramatically change prior authorization, which, by the way, does reduce costs, but it's done wrongly at times. And they've got their part done. This coalition that we announced is getting all the hospitals to join in as well. Because listen, the insurance companies can't do it by themselves. They actually have to have the doctors in the hospitals working with them. Because if I ask you, hey, listen, justify this procedure, and you fax me back the response, you're wasting time.
Right.
We got to do it all digitally. Everyone's got to get on their game seamlessly. That's why the commitment we're having to the American people by next year is you'll have 80% of these prior auths done instantaneously. Like
Fantastic.
when you go to a bank, you put your card in there, right? You don't wait around. The money comes out. When you go to a coffee.
I mean, I got to pay a couple of dollars, take out my own money. That's a whole other story, but go ahead.
It's a whole different story, right? But you also, if you go to a coffee shop, right? The barista doesn't, get back to you in 6 weeks if you have the money to buy your coffee.
Right.
They make the deal right then, or you wouldn't use the transaction.